Melissa Memorial. It's in a little rural town in Colorado called Holyoke, Colorado. It's about 2.5 hours from Denver. So we have a patient that lives in Denver, and she was in Holyoke for something in 2022.
Some Holyoke.
And ended up in the emergency room. Turns out she had some sort of cyst, an ovarian cyst.
Oh, and it ruptured?
Yes, and so super painful. So she went there because it was the closest hospital. The patient is fully insured through Anthem.
Oh, and it ruptured?
Yes, and so super painful. So she went there because it was the closest hospital. The patient is fully insured through Anthem because, you ready? Wait for this, wait. Melissa Memorial is out of network. So why is this patient paying insurance and she gets zero benefit? So here's the really big twist. Now Miss Melissa Memorial has hired a lawyer and has filed suit against this patient, and it's over $7,000 for IV fluids.
So why wouldn't our insurance be at the other end of getting sued? Because they're the ones withholding payment.
Melissa Memorial gets $7,000, or they want to have $7,000, and this poor patient is probably going to have to file for bankruptcy because of this. This is not healthcare, and this is somebody that has health insurance.
Right, like Anthem would be fully insured if she was here and went to DePaul.
Yeah, because she was traveling for some, I don't even know what she was doing, but
is it the same as our insurance?
It's
She shouldn't.
Yeah, so it's so marginal. And this, I think everybody, we can talk about the details later.
I was going to say, we have out-of-network benefits.
Well, apparently Melissa Memorial doesn't accept those. So, this is...
Hi, Jack.
This is horrid, okay? So let's look, I tweeted out to Melissa Memorial. Of course, they have no Twitter page, but by God, they got lawyers. This is garbage.
Well,
Melissa Memorial Hospital in Holyoke, Colorado, is hired a lawyer to sue this patient. They already filed suit for $7,000 for IV fluids.
Imagine being
fully insured patient.
Imagine not having you though. Like a patient would just be like, I've got to go to court.
No, what they do is they file for bankruptcy because.
Just got on here. But if the patient was out of network, are there no surprise billing protections there?
I don't know. We're going to have to dig into it.
Thank you, Tech. That's the way.
I like the ideas.
Better off negotiating on out-of-network claims. Yeah, the No Surprise Act. You can't just send a $7,000 bill.
Oh, they did. Not only did they send a $7,000 bill.
One defense is an unfair claim.
Well,
it's true.
Okay, I like these ideas. So the patient is like super freaked out.
Anyone that gets a notice to show up in court is gonna get nervous.
And so she sent us this information. So anyway, after I think right away we're gonna start working on this because this is what we do when we help our patients.
And luckily, I've been irresponsible enough and I worked at Mercy to know how to work these. They need to initiate the dispute process. Oh, trust and believe. Target sued me once, and
there's no problem paying a reasonable fee for services, but when you have a rural hospital that's there to serve the people, God knows they're getting federal funds. They're getting all sorts of tax dollars.
Isn't this why our legislators they voted with the PBMs?
This is why
it's more affordable.
Sam Graves and Eric Burleson claim that PBMs are so great to keep the rural hospitals in business. Buddy, guess what? The rural hospitals don't have any problem staying in business. And they're litigating against poor patients.
Yeah, kicking the poor patients out of their homes. That's more than a house payment. That's 7 house payments.
$7,100.
That's
it is. Let me see here.
And
I'm sorry. It's $7,471.10.
And anyone that works in the hospital is fully aware that if you let it go to bad debt, you can negotiate it down like 80%. So at most, she should have to pay 80% of that.
Well, this is healthcare. It's horrid. that patient has been paying her premiums for however long she's been on this insurance. That patient was fully insured through Anthem, and here we go, $7,400 bill for IV fluids.
Yet we have to send patients over there to get their infusion because it's more affordable.
Yeah, it's such garbage. You know, this is just when you go to the emergency room, do not present an insurance card. Tell them you are self-pay. You got a chance of cutting a deal. If you present the insurance card, you're gonna just pay the whole bill. That's just how things work.
What hospital was it?
Melissa Memorial
Hospital.
Memorial
Tech is our
Hospital
BJ's friend.
in Holyoke, Colorado. It's a small little town about 2 hours from Denver. Okay, so this patient was traveling and ended up in this rural town. And what hospital was it? Yeah, Melissa Memorial in Holyoke, Colorado.
I want to look at their ratings.
Well, it doesn't matter what their ratings are.
That's insane.
This is
for IV. I've had a
IV
cyst
fluids.
rupture.
Yeah, and it's super painful. This is not healthcare. The patient, 100% covered under fully insured Anthem, but Anthem denied all the claims, paid zero, and here we are. I'm sorry that people haven't heard of it, but you'll hear of it if you end up in Holyoke, Colorado, and you need a freaking emergency room. But I'm just, this is the kind of stuff that hospitals are not doing the Lord's work here.
Well, and they're not leaving Melissa a good memory.
They're filing lawsuits. I would have tweeted out to Melissa Memorial, but guess what? They're not on Twitter.
If they're a critical access hospital, those are a bitch to negotiate because they don't follow OPPS.
Well, I'm sure they've decided they're critical.
Probably. I mean, Jack, you're a real hero, though. I appreciate all of your input with all of this. You really do help a lot.
I mean, it's just as we advocate with patients.
Oh, they're about to have a black tie affair that you're paying.
Of course. Well, maybe we can buy a ticket, or maybe buy $7,400 worth of tickets on their black tie affair.
They're in the top 100 best places to work.
Oh, please. Yeah, you're in the top 100 best places to work because you screw the patients. Something's going on.
Oh no, that's just...
Okay, so anyway, what I want to talk about today is literally non-medical switches again. Yesterday afternoon, I was getting my hair colored. I have to go every 4 weeks because I would be 100% gray if I didn't. So I'm sitting with foil and getting my hair colored.
She looks like she's an alien believer whenever she's getting her hair done.
So I'm getting my hair done, and I get a phone call from my friend Jill here over at CVS. Okay?
Oh, I thought you were talking about the scheduling one.
She's not really my friend. And I don't know, should we play the message she left me? Can we do that?
Yeah.
Okay, let's do that. Let's see what Jill has to say.
Oh, from...
How come it's not working?
We have found someone that could address your and Dr. Bach's concerns about the switching patients from Humira to Hyrimoz. If you could give me a call back at 504.
I've got a patient dealing with a $26,000 bill, worst of worst, and I've been able to get $14,000 at best. So, I mean, if I can get $3,500, that's best. But we all know they're raising up the allowable and they're charging us the entire allowable amount, I'd imagine, without putting the self-pay price. So at least they should have given us a discount for cash paying because we have no option to because apparently our insurance is out of network.
We tried to work with these people, and I know that the patient had offered them $1,700, and they said, no, we want the full amount. So
they haven't met me yet, though.
So we're going to get that done. But let's talk about CVS Caremark, a big PBM with their big heart logo.
They might as well be in doctor's office at this point.
So CVS, so this gal Jill from CVS Caremark called me last night, and she's like, yeah, I know that Dr. Bach wanted to speak with one of our medical directors about the switch. They call it the switch from Humira to a biosimilar, but it's really a non-medical switch. And she goes, we're not sure exactly how many patients you're talking about. Could you email me some of the information? And I said, are you kidding me? I've got at least 50 patients that this applies to. And she goes, well, could you just email me tomorrow, meaning today, one of those cases so I can see it? And I'm like, you guys are the king and queens of data, and I have to go through our patient roster to find your shit.
I've got a couple if you need them.
I do need them. We're going to send those over. I'm going to be sending those over this morning to Jill. But do you understand that CVS, the PBM, Pharmacy Benefit Manager, is demanding that physicians write a prescription for something that they make more money on? We are not doing it. And I talked to Dr. Bach about this last night, and I said, you know what? I think we need to have all those patients that CVS is steering to their own shit. CVS needs to find them a new rheumatologist, because we don't have time to deal with CVS yanking us around. So I'm going to get those cases from her.
Maybe the primary care provider would be more than happy to follow CVS's rules.
Well, I'm sure there are people that just are like, you know what, I don't want to tangle with CVS. Let's just do what they want to do. But guess what? We're not going to do what you want to do, because we know, and I even told her, I said, in 2020, Dr. Bach made 2 non-medical switches. We filed MedWatch reports with the FDA.
Can you explain what those are to the people?
Yeah. So a MedWatch report is something you file with the FDA, Food and Drug Administration. I actually, we should put that out so they can see those, because it's all redacted already. But
he could have put them on Remicade. That'll be cheaper with the laughy face.
Well, I don't know. I mean, the thing is, whatever these patients need to be on is what they need to be on. It takes such a long time in rheumatology to get a drug that works for patients, that the fact that CVS thinks that they can just willy-nilly yank these patients around. Oh, and the other good news is they want it done by April 1st. They are calling, CVS Caremark is calling the patient saying, you need to call Dr. Bach and tell him to write a prescription for this. Like,
I had a patient that's in medical school right now, and she's like, so they're saying that they're not going to fill my prescription. And I was like, Dr. Bach does not do non-medical switches. So if you feel like your Humira is benefiting you, just because it's a biosimilar, it's exactly that. It's similar. It's not the exact same thing. So you could have a completely different reaction to it. And I even asked her, I was like, I mean, we're going to fight for you as long as you're willing to. And she's like, yeah, I agree with you 100%. I was just scared I wasn't going to get my medication. That's what they made it seem like.
Well, I'm sure CVS is saying you're not going to get your medication. They're going to do anything possible to make the most money, because apparently CVS doesn't have enough
the ball
money.
And didn't pay him enough.
Yeah. So here's the dealio.
Wasn't Humira on everyone's formulary last year, basically?
Yeah, well, that can change, because apparently the pay-to-play list, the manufacturer of Humira didn't pay enough money.
Does that change every year?
It can change quarterly sometimes, but at least yearly, because, you know, all of these PBMs have their staff that go out and negotiate for formulary placement, or what we like to call here a pay-to-play list. So all the manufacturers come in and say, we're going to pay you, $1 billion to have this drug on position 1 and 2. And then the PBM pulls it all together and says, well, but this company will pay us $1.1 billion to be there. So that's what we're going to do. And we're going to still take your $1 billion, but you're going to be in position 2. So whatever happened between the makers of Humira and CVS, someone didn't agree to pay the price. And guess who suffers? The patients.
Well, and it's just so crazy for Jill to be like, what are you talking about? What are you talking? We
don't really know what you're talking about.
Requiring a switch of, and then she's gonna see it and be like, oh, we didn't realize it was for Hadlima, the biosimilar that you can switch out. So Humira is out, but they didn't pay enough, so now the patients suffer. Yes.
But here's the thing: we can't just willy-nilly switch patients' medicine. The patients have to come in. We got to rework them up for everything again, because if we did a non-medical switch to what CVS wanted, chances are there's a really good a high probability that it's not going to work for patients, and then they will never be able to return to branded Humira again, because that's what happened in those 2 MedWatch.
And how hard is it to get them back stable?
It's hours and hours of work for the physician office and for the patient. So and the patient's harmed.
If you're, say, not a rheumatologist, you take over the care as a primary care physician, do you think they'd know what to do exactly?
I mean,
because I know there's not.
They don't have none of these doctors have all this extra time.
My primary care physician even flat out told me, he's like, listen, there's a reason I'm not a rheumatologist. Everything changes. Nothing is for certain, constant. You have to be a expert. He's like, I know the ANA, I know this and this, I can get the basics, but I'm not comfortable treating people for rheumatic diseases.
Well, and the biologics, I mean, we always, at the core of what we do here is to do no harm. And we are balancing, we are manipulating the patient's immune system, and we suppress it
because
with
their
these
immune
drugs,
system's overact.
and their body is attacking their body. So it's not like a formulary of, oh, well, if you have ankylosing spondylitis, then you have this treatment. If you have this, if you have rheumatoid arthritis, then you have this treatment. But here's the thing. Most of our rheum patients have at minimum three chronic diagnoses, but a lot of them have like 10, and some of them even have 20 chronic diagnoses. So we can't have their liver, completely in the tank. And we have to do these labs every 3 months to make sure that things aren't.
And their symptoms are constantly changing. So they could have a flare-up of their, let's say, Sjogren's. They're going to have dry mouth, dry eyes, everything itch, whatever. And then they could have a flare-up of rheumatoid. And all of these symptoms for these diseases are different. So your treatment plan, my treatment plan is going to be completely different than Julie's, because I could have a completely different disease workup and treatment plan. We could have the same medication, one of the same infusions, but that just means that it benefits both of our symptoms in a way that we're able to continue on living our everyday life. I think a lot of people get confused with rheumatology medications because they're like, my boyfriend's on methotrexate and he has gout. And it's like, he probably has more than just gout.
Right.
And are we comparing our medicines?
This is not one size fits all. It is literally one patient at a time. Back during the pandemic, Actemra, which is a very old drug, Actemra has the subcutaneous injection formulation and an IV formulation. We had 39 patients on IV Actemra during the pandemic, and some bonehead sold out to the government and said all of the Actemra is going to be diverted for COVID treatment, and none of it will be to the rheumatology patients. We had to bring 39 patients in here. And by the time you're on Actemra IV, you have tried and failed
everything.
At least 75% of our medicines. So all of those patients had to be reworked up. They did terribly. And of some of them, when the IV supply came back a year and a half later, returned to Actemra, some of them it worked for, but a lot of them it didn't. So non-medical switches are a huge frickin' deal.
Well, and an adverse reaction creates kind of a fear for the future and different medications you're going to try. You're going to be like, am I going to have an allergic reaction? Especially if they end up going by ambulance. That's a traumatic event.
100%. And CVS and their Caremark, they need to go sit down at the table with Melissa Memorial.
Well, and it kind of makes me nervous with Pathwell, because they're trying to get everyone to home infuse, but nobody.
Pathwell. Cigna's yesterday's news.
But these people at home giving themselves the injection, if no one's with them, if they have an adverse reaction, they're just gonna on the floor.
Oh, I know. I mean, that's not part of CVS's, heart and their care.
They're sending us messages about, they have all this time to look over contradictions of medication that doesn't even make sense, but not follow up. I've never had a follow-up call from a CVS person when I've had a new medication.
CVS is in it for CVS. It's just, my hot buttons today are non-medical switches, specifically with CVS.
And hospitals.
And hospital billing. And I am hating on Melissa Memorial and their tactics of suing one of our patients for $7,400 for IV frickin' fluids.
And this is why 1 in 4 families are filing for bankruptcy due to medical debt. Because if I got that...
Who in the hell has $7,400? Who? We tried with this patient. What?
I'm like...
Oh, me? Listen, don't look at me. The difference between me and you is I can borrow $7,400 pretty quick.
I can remortgage my car.
No, I have more borrowing power. But you know what? Everybody's a patient, and everybody is.
Even with money, you shouldn't have to pay $7,000. It's just not. You know what you could do with $7,000? You do, but a lot.
Yeah. A lot.
And just to pay for IV fluid. Like, I want to ask our infusion nurses, because we almost gave you IV fluid. Like, how much
No, we did. And listen, IV fluids are necessary. We need to have like a room in the emergency room that's just for IV fluids. And you come in, you pay $200 or even $500 for IV fluids, and then they get you the hell out of there.
They have those wellness clinics where you can go for IV fluids.
Well, those are garbage, guys.
They gave me a shot of vitamin C in my butt, and I didn't feel anything. I had to pay $100.
Don't go paying for IV fluids at a freaking IV bar.
It
That's
might be
garbage.
better than freaking $7,000. I'd rather risk that than risk getting sued.
Well, I don't know. Healthcare's in the toilet. Education's in the toilet.
Exactly.
The world
it's not
is
fair
in the
and
toilet,
it's not
and
reasonable.
we need to just work one patient at a time and row for the shore and just doing the best we can against some really disastrous, big, powerful people.
Well, it's kind of scary because we're in a rough spot because we have angry patients and then we have angry insurance companies, and we just had we saw real anger with that one video. And it's like, if that patient got mad at me for changing something, I have a hard head, but
Not that hard.
I don't know. I do speak French, but
Oh my God. She does not. She spent some time in France, and now all of a sudden she speaks French.
and Spanish.
Oh boy, there we go.
Karen.
Multilingual.
I'm
Multilingual.
trilingual.
Oh geez. Okay. All right. Anything
Exactly.
else out there
Jack
today that
said-
we want to talk about?
Well, Jack said exactly. It's not fair and it's not reasonable. Jack's a good friend of ours. He always tunes in. He's
Hi,
really
Jack.
good at billing.
Okay, so I just want to then leave you all with this thought. Melissa Memorial
We got 11
Hospital.
people. We're not leaving them with any
And
thoughts.
okay, Melissa Memorial Hospital in Holyoke, Colorado, is suing a patient of ours for $7,400. Filed yesterday in the court in Colorado. So this poor patient is super freaked out, and Claudia is going to get on the phone and try to help her.
Leslie
out
said,
her-
"You all are awesome."
Fill out this stupid thing.
Oh, it'll be. I need to just call the hospital.
Well, you're gonna figure it out. But what else can we do? Like, we spend, the two of us,
Profits over patient care. Yep,
that's
I like
exactly
that.
what it is. We spend the majority of our time working on the hard cases, and this is a hard case. We will get it resolved, or well on to getting resolved today.
Or at least like a payment plan, but we're not $7,000 for IV fluid. I'm gonna be like, listen.
I mean, this is a patient that she's young.
She fights
she's
for
29 years
and
old.
works with kids that have special needs.
Yeah.
She's spending her time doing the Lord's work, and then she's getting smacked in the face by the government, even though she's helping them. Good job for showcasing this to bring awareness. Thank you, Blondie Girls 23302. Hey, our lipstick kind of looks the same.
It does? Okay.
But it's just scary and it's sad because luckily they have the resource, but I can't even imagine how many people don't have that resource and are being taken advantage of. Luckily, I'm not scared to go legally blonde. I love going to court. It's become my Super Bowl going to
But
court.
here's the thing: if patients could shop for healthcare like you shop for a TV or you shop for anything else, give us the price up front. If this patient was told, hey, it's going to be $7,400 for IV fluids, you know what I think she would have done? She would have probably said, you know what? I'm going to be taking a different route here. I'm going to go find some. I'll drive back to Denver and get into an in-network place. That's what she probably should have done.
Leslie said, if you ever have any specific questions about pharma samples and or patient assistance, just ask.
Beautiful.
Send me your email. If you could direct message it to me, I'd appreciate it. I wonder, I'm seeing how much it would cost at Oklahoma Surgery Center to get your IV fluids.
Well, it doesn't even matter because she couldn't drive there.
Well, I know,
We
it'd
have-
just be
we
a
have
very...
we have to help these patients because this patient is super freaking scared, okay? Melissa Memorial Hospital, $7,400, hired a lawyer, and now she sent us this, and we got to work on this to help these patients because rheumatology
She'll
patients
do a real-time benefit check.
great. Rheumatology patients are so complex that how are they supposed to spend their time and energy healing, and then you get this nonsense?
Well, it's like something we learned at one of the conferences we went to, and it was like these people are so, if they're mentally not well, they can't focus on healing because like your brain, if your brain's not healthy, it's not going to send out the right whatever, can't think of the word, to where it can help your body heal. You're going to be sitting there just stressing, making it more horrible, putting yourself into a flare, and then you're everything.
And then you're in a panic, and then you're all now have anxiety on top of being poor and broke and hurting. Now you've got more anxiety over bills like Melissa Memorial.
Well, and I had a patient on the phone, and she's like, I went to the emergency room, like my inflammatory marker's really high, but they said it's the anxiety and that I'm crazy and I need to go check myself into center point. And all I said was, you're not crazy. Like, you just had the flu, you just had this, and you're probably in a flare-up. I said, you're not crazy. And she just started crying. And she's like, thank you. I just needed someone to say that. I felt so, and it's heartbreaking because it's like these patients are being told, because it doesn't show up in a lab, seronegative. So if that's not showing up, a regular doctor is gonna be like, you're fine, you're just being dramatic, and if you have anxiety and depression in your chart, it's automatically listed as in your head.
Well, that's one thing we really do here is we listen to our patients. We listen to their symptoms. Doesn't really matter how bad your back MRIs look and the films and the x-rays. What we're gonna help you do is get better with your disease using medicine. We are not anti-surgery, but sort of anti-surgery. The thing is, when you have a surgical solution, it's not a solution for an inflammatory patient because you'll end up with the surgery and then you still have the inflammatory symptoms inside. And so we really just try to treat patients. We try to hear them and hear what their concerns are, and we partner with them to get them better. And then in the meantime, we get this other bullshit from, have I mentioned? I'm hating on Melissa Memorial today.
It's just so sad too because we're treating the symptoms and managing the disease, but a lot of people are just taking it out. Like my brother, Jack, everything was taken out.
And you understand, her brother passed away.
At 30.
At the age of 30, after multiple surgeries, and
he had everything taken out.
Yeah, and because they would just start removing organs but he probably
small
had
intestine, part of his
probably
stomach.
had a rheumatology condition.
Oh, my labs came back and I have some, so it's like it runs in the family. But if it would have treated like the pain in his stomach, if it would have been treated, or if it was in the back, or if he had
Crohn's spondylitis.
Well, he did have Crohn's disease, but it was just never treated. He never saw a rheumatologist, nothing. And what happens then when you don't have people that advocate for you, because I wasn't, I just listed them off, is you start hiding from your problems, taking pain medicine because nobody believes you and you feel crazy, and then it turns into the problem. So we have to be the solution.
Yeah. So her brother died at the age of 30 because nobody listened to him.
What does the St. Mary's patient need? How can I help? Leslie said.
St. Mary's, it's Melissa Memorial in Holyoke, Colorado. This patient is one of our patients and who traveled up to Colorado in April of 2022 and had an event of a burst ovarian cyst.
Cyst rupture, yeah.
Yes, and so she obviously was in extraordinary pain. They gave her IV fluids and a $7,400 bill, and she doesn't have that kind of money. She's only 29 years old.
I'm sorry to hear about. Thank you, I appreciate that, but I feel like you have to go through these things to know. So he never really had a chance, but at least now I know I can be the person that I wish I would have been for him to these other patients. I mean, me and Julie kind of go up to bat sometimes because I'm like, no, they stubbed their toe and they're really angry. We can work through this. I'll call in a favor, Leslie said with a winky face.
Really?
Hey, appreciate
Great.
that.
We would love that. And you know what?
He was in the military too. He was in the Marines. So
Her brother, who passed away, his name was Jack. And he is a casualty of the opioid crisis as well, because it was easier for physicians to give him opioids and get him the hell,
was even a thing to
get him the hell out of their office rather than listen and treat his symptoms. Now, he might have just had a predisposition to go for it on opioids. Again, nobody would have signed up for that and voted for that. He was killed by the system.
Well, and we do care, like a lot of patients are addicted to a routine, I've learned, because we are reducing Dr. Bach's reducing what he prescribes opiate-wise because we want to make sure we're managing the disease, not just the symptoms. So we don't want them waxing and waning through life, not remembering things. Nobody wants to not remember times with their grandchildren, but people are so addicted to the routine of taking their medication to where they're taking the same medication for 13 years. I trust and believe I know this much. You build up a tolerance after that, so the medication isn't doing anything. I'm so sorry for your loss, and as a vet, I thank him for his service. Thanks, Jack. Thank you. I appreciate that, and thank you for your service also. Wow, you just got me tongue-tied. But we do treat a lot of patients that are addicted to pain medication, but if we sit there, I'll sit in a room with them. Julie's like, go talk to him, and I'm like, listen, we want you to feel better. If you think taking this medication in the morning is the only thing that's making you to where you can play with your grandkids, you're sadly mistaken. We don't have your treatment plan right. So we're constantly working on that, and people get very nervous with changes, I've learned.
Well, when you want, the opioids, short-term opioids for, pain from before or after surgery, that's one thing, okay? But long-term opioid use is really, really difficult. And it's just harder and harder on the patients and on the doctors doing the work. So what we're really trying to do here is get the patients feeling better with biologic medicines, either sub-Q, oral, or IV, so that they don't need the pain medicine, or they need less pain medicine, because somebody that has a prescription for hydrocodone in their house, if they have teenagers, if they have young children in their house, they are all at risk for putting their whole family at risk for getting into that pain medicine. And Dr. Bach frequently counsels patients and says, let's get you off of this. You do not want to bury your grandson. And we have to do that. We have to do right. Dr. Bach had a patient, this was a couple of years ago, and she came in and she said, I don't want hydrocodone. He goes, well, that's great. I don't want to prescribe it. And she said, my son died a couple years back, and he and 4 friends had gotten some marijuana joint that had fentanyl in it, and all 4 of them died in her house. Like, how do you overcome that shit?
You don't.
And the thing is, it's like we just have to work with patients, get their pain under control, and manage their symptoms with medicine.
And we can do it without the pain medication. We can do it. You don't have to have pain medication in order to live your life every day as you would with the pain medication. You could, if we get your symptoms under control, you'll feel better than the pain medication makes you feel. Your head will be clear.
Yep.
Oh my gosh, me and Julie were just talking about how pain medication makes me really sensitive, and it made you really sensitive whenever she cried to Dr. Bach. I cried over orange Jell-O. It's just your tolerance to handle just the smallest things, which our angriest patients are the ones that need a refill on their medication and are out of compliance.
If we're going to have patients that are pissed off and angry, 100% of the time, they're on a Schedule II drug, like hydrocodone, Percocet, something like that. It's 100% of the time.
And we have compliance. You have to stay in compliance. And they're very well aware of these compliance rules. So, but every single time, it's sticker shock when I tell them about the compliance rules. But it's like to keep them safe, and it's to protect us too. Because we don't want Dr. Bach to lose his license.
No. No.
Can you think of all the patients that would be SOL?
I mean, we just have to continue to go
So
one
hydro
patient.
with bead tech was once a thing.
We just have to continue to advocate one patient at a time, and we encourage everybody out there doing this work to continue in the fight. I know it can really get you down after, day in, day out on this.
I think this week me and her both have just been like,
yeah, well, we've got some really crazy shit going on with one Medicare Disadvantage plan here in St. Louis, and they literally, they just literally don't give a rat's behind about the physicians doing the work, and they certainly don't care about continuity care for their patients. But when an insurance company knows more than the people doing the work, we have to say, Bye, Felicia.
Right.
And we did.
It's daunting, but if we don't start, it's only going to get worse. Well, and that's kind of why we started bringing it to TikTok. We've gotten a lot more traction than I ever thought on TikTok, because I thought you had to do cool dances, and I have no rhythm.
I'm not a dancer.
And,
I'd like to.
But the amount of people that have actually learned from us, they didn't know what's going on behind the scenes. They just thought it was the doctor dropping the ball. And it's like, no, we're just working here trying to answer these 72 questions for why you need folic acid.
For one freaking medicine, a cheap, methotrexate is like a super inexpensive drug, and these stupid insurance companies want us to take our physician notes and fill out their stupid forms so that they have something to do.
We have to send them the physician notes after every office visit.
Ridiculous. And we do the same thing, and it's awful. I mean, it's like, and then you have to transcribe your own physician's notes onto their stupid form. So these insurance companies, particularly this one Medicare Disadvantage company that I hate, so that they have something to do. Why can't you guys just approve care and quit dicking around?
Stop putting the patient's care, like everyone thinks, like with that one TikTok we made about the invoice, everyone's like, oh great, only the patient's gonna suffer. And I'm like, do you not realize who's causing the patient to suffer? It's the insurance company that's requiring this stupid form.
It was a 3-day boycott.
We started
on inexpensive medicines. Okay, we started to do the prior authorizations. We never stopped on the expensive medicines. We stopped for 3 days in January, and it has caused so much upset.
No, that video is still going viral.
Here's the thing: if we don't stand up, the physicians' offices are gonna shutter, and they're gonna be like, "Forget it. This is too freaking hard. The juice is not worth the squeeze. I might as well retire early or whatever." Like, we have to continually do the right thing and stand up for what is right.
Have you all been impacted by Change Healthcare?
Oh my God, yeah. I was telling her, we haven't gotten paid in 3 weeks. 3 weeks.
Don't worry, we can get a loan from United Healthcare.
Oh yeah, from a payday loan from United Healthcare. Luckily, this office has a big line of credit that I tapped
Jack
into.
said, have you gotten the $99 check yet?
No, we haven't, but we have gotten prior authorizations reduced from from some insurance companies, and we even had a couple of them approve the medicine with no prior auth.
I just paid cash for my mom's Zofran, a PA for Zofran, 92-year-old vomiting.
They don't give a shit. Insurance companies and PBMs do not give a shit.
A high interest loan, tempting.
Yeah, right? Yeah.
The last person I'd want to owe money to is the healthcare that I'm fighting with. Could you imagine? They'd be like, we're revoking your loan, pay us back 30% interest.
What if United Healthcare did like title loans? Maybe we could see if Dr. Beck's title, he doesn't even have the title because the car isn't paid off. Maybe we could get a title loan on his Tesla to pay our payroll. That's a good idea, United Healthcare.
Well, it's just very, what's the word I'm looking for?
Daunting, overwhelming.
It's just tone deaf. Don't worry. Here's some money, even though we haven't paid you yet.
Well, supposedly the latest United Healthcare Change Healthcare
It's amazing
update.
how long they packed this, though. I'm very impressed at the hackers.
Supposedly, it's not even going to be online until March 18th.
Mid-March.
Now, if they say March 18th,
that means April.
Understand, your physicians and your hospitals are not getting paid. I bet stupid Melissa Memorial's getting paid.
No, they're probably not. That's probably why they sent that.
Oh my God. Did I mention that I hate Melissa Memorial Hospital and that they charge $7,400 for IV fluids for one of our patients? Mm-hmm. I just literally want to just ball up my fist and just scream with this.
Leslie, I know it's just the start of hacking season. I was telling Julie, I was like, if they've found a route into one insurance company, the makeup is the same for all of them. And actually Medicare, TRICARE, both of those have been impacted, I read already.
Everybody's impacted.
I heard United is being investigated for antitrust laws.
Yes, they are, but the DOJ, the Department of Justice, has investigated United before, and always the cases get closed with no charges filed because United Healthcare runs CMS.
But apparently they're not willing to pay that much money because they haven't paid the hackers enough. And these hackers, I can only see they're gonna get it up for like a week, and it's just gonna go back down. these hackers are gonna mess with them so much, and I guarantee it's in the United States. They're trying to blame it on the black cat. I have ADHD, so I enjoy going down rabbit holes, and I guarantee it's a hacking group in the United States.
Well, here's the thing. I had read an article that maybe United Healthcare planned this so that they could drive the price of practices down and then buy the practices for pennies on the dollar.
Which has already happened.
Yeah, it has happened. I don't know if they're that evil, but maybe.
I think so. I mean, you look at the guy at the top. He's like, how can we get control of like right now we have these 3 opponents. How do we control all of the indie physicians? And they're like, why don't we just pretend we get hacked?
It's not impossible. Anything is possible when you're dealing with a cartel.
So they can hold on to your money longer, exactly. Or they can come back and do a couple clawbacks because, I didn't approve. That needs a prior authorization.
Understand that physicians' offices haven't been paid in 3 weeks. So, like, we are having to tap into our line of credit to keep our payroll going. This is like unbelievably uncharted territory, but trust and believe United Healthcare continues to post multi-billion-dollar quarterly profits while the rest of us suffer.
While they send a $2,200 million, that's it. It wasn't.
No, it was $22 million. $22 million is like me giving them
that's
22
like
cents.
Probably one patient's information. Guys, trust and believe. There's no such thing as HIPAA anymore. All of our information is in the black web. So if you're nervous, my direct primary care gets paid. Love that,
yes,
Gail.
Yes.
Love that. That was
smart,
a good one.
Smart.
We like a quick one.
Direct primary care is the way to go. And if you need specialist care, everybody that I know would be more than happy to work for cash, including me.
And look up FMMA for your state. There's lots of providers out there that are willing to do direct care or concierge care.
FMMA is Free Market Medical Association.
Did I say that really fast?
Yeah, I'm just, I'm here doing translating for the older people, my colleagues that are now almost 60.
When I was
59.
in France, all they said was, blah, 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 blah. You talk so fast. Oops.
You'll have
but
that.
they are buying up clinics that are going under. Interesting, huh?
Yes.
22 million, just 0.0067 of their profits. Right.
Yep. I mean, literally, I could go to my desk drawer and probably find 22 cents in there.
I was going to say 22 million.
No, for me to pay somebody 22 cents is what it means for United Healthcare to pay the hackers 22 million. It's like nothing.
My son's therapist almost dropped him because she isn't getting paid.
Yeah.
I think a lot of people are going to end up dropping United Healthcare. I'm surprised that hasn't crossed her mind yet.
You know what? We can't dump them all, but I'm on a roll here.
I heard you say it to Anthem the other day. I was like, ugh.
No, I mean, listen, we don't want to have adversarial relationships and bad relationships with insurance companies, but they aren't responsive. They are the ones harming, delaying, and denying care, not us.
And they come into our office and they're like, oh, here's our card. With any problems, just send an email or call. And Julie has multiple times. I have. And they're like, let me look into this.
And then crickets. That's like the CVS thing. She's like, no, I'm going to have an answer back. It's been like 9 or 10 business days since they got back to us, and she calls me last night acting like they don't know anything about this non-medical switch of Humira. They know all about it.
I made my husband quit his job because his company switched to United Healthcare. And then Leslie said, let's start our own insurance, patient-centric only costs. That's direct care. That's what we're aiming for. Join our revolution.
Direct
Boston
care.
Tea Party.
Because here's the deal, guys. This poor patient has been paying her insurance premiums forever. She's 29 years old. And now, even though
This was her birthday present.
Now that she has paid her premiums, she's fully insured, and she still gets a $7,200 bill for IV fluids from Melissa Memorial Hospital. Do you know, I had a back surgery on February 26th.
It didn't even cost that much.
No, guess what my back surgery cost? And I was fully put under with anesthetic.
Very handsome anesthetic man.
Very handsome. My back surgery, which was L5S1, that cost me out of pocket $3,000. Of course, I have my Anthem that paid nothing on it because it went all to my deductible. Thanks, Anthem, for nothing. But again, $3,000, that seems like a reasonable fee for someone to operate on me and put me under. $7,400 for this shit is not reasonable. It's not reasonable and it's not okay. And if they do it to one patient, this is how they operate over and over again.
$99 a month, unlimited visits, functional medicine for primary care doctor. I know this is a big question, but are we ever going to see health improvement?
We are not.
Unless we switch to direct care. I'm optimistic.
Healthcare as we know it is
trash.
It's trash, and here's the thing. The people making the decisions are never going to give up their gravy train. Their revenue streams have revenue streams at the insurance companies. So the reality is we're all paying insurance premiums, and then we all get to pay all of our own bills. So why not say, I'm going to get some catastrophic insurance, and if I get hit by a bus, okay, then I'll be covered. Everything else, I'm just going to pay through direct care.
Direct care divas.
Direct care divas, DDD. I like it.
That's what Leslie said. And
Okay.
then my insurance won't pay for a mammogram. Isn't that?
Of course they won't. Why would they pay for a mammogram? I mean,
Unless you have cancer, we will not pay for it, is what that
that
sounds
tracks.
like. It's the catastrophic care that scares me.
Okay, well, it's a catastrophic care that scares everybody, but let's not forget this patient is getting a bill for $7,400 for IV fluids, okay? IV fluids. This
Water.
is hardly catastrophic care, but this patient's gonna probably file for bankruptcy. Unless we can help her, but we're gonna try.
We will. I like to think optimistically, yes. Sorry. What am I doing? Why prevent a sickness? There's no profit in prevention. Not everyone's looking for profit, though.
I mean, we still need to treat people. We still need to use medicines. There's so many amazing medicines that can really help. And it can change people's lives. It can give them their lives back. So we're going to just continue to advocate and literally fight one patient at a time. We encourage everybody to do that with us. We want to partner with people, and if you guys want to help us,
Come on our Zoom. We would love that.
We would love to talk to other people that are doing this kind of work, because there are more ways than not to help patients. So let's do this together.
My dad had cancer and paid $15,000 cash. If he would have went through insurance, triple that.
100%. 100%.
45,000.
Yeah,
Sorry about
look
that.
at her with math is mathing for Claudia. Yeah, listen, the patients are going to pay no matter what happens. You pay premiums, you're going to pay through your deductible, and 90% of patients do not hit their deductible in a calendar year. 90%. So the sickest patients, 10% of the patients in the United States are the ones that hit their deductible every year, and there's
She's
the sickest.
one of those.
Well, I don't think I'm going to hit my deductible. Our deductible's $6,800. Or
Interesting.
I don't think I'm going to hit it. Well, who knows? It's only March.
Profit should stay out of judicial, health, and education systems. Why is it that they only stay out of church and not the others? I feel like all of those should.
The church is in trouble too, though. I mean, I was telling my colleague that healthcare is in the toilet, and she said, I work in education. It's in the toilet. Education's in the toilet too. It's like anything that the government gets involved in is even made more complex, more burdensome, and more expensive.
Church should pay taxes.
Hell yes, church should pay taxes. Everyone should have to pay taxes. I wonder if Melissa Memorial is paying taxes.
I doubt it, because they're memorial.
Who knows?
But Melissa, I bet she's not very happy with her memorial. She's up in God's care.
She's in a pine box from way back.
Do you guys know what a pine box is?
It's a coffin.
Please let me know if this is common knowledge, because it took me a year to figure out why we were sending pine cards. I was like, that's a nice tree, a pine tree.
So in this practice, we send patients, or if they have a loss of a family member, or if certainly the patient dies, we send the family a grievance card. And so in our task, I started coining the phrase pine box, because I don't want to send somebody 2 cards for the same instance. And we also just track everything. So like One poor patient, he lost his mother and then he lost his daughter. So then we'd have these entries in there of what it is, and the cards, the pine box cards, the condolence cards are routed to the entire staff, and
Hand signed.
Everybody writes a little something and says a little prayer, and I gotta tell you, patients come in here with their cards saying, you guys are my family. This is the only card I received for my mother's passing, or whatever the situation is, and it is human touch. It is the human
Usually you'll both start tearing up, and we're like, "You're welcome."
I mean, it is how we connect with another human, through saying, "I see you, I see your loss,
and we
I
care.
feel for you, and we're thinking of your family." So anyway, that's my little pine box tab.
Look at her; your eyes are watering a little bit.
Well, it's you know what?
This whole surgery's really brought out. What's that? Verified to continue. What is this?
Oh my goodness.
It's still going.
Okay.
I passed.
Yes, this surgery has really kind of has me questioning and recognizing my own fate. Because, no, for real, it is okay. I mean, look, I might have, if I'm super lucky, I might have 20 more years in me. I'm 59. That 20 more years if I'm lucky.
I'll know you as long as I knew my dad.
Okay. All right, let's.
We're gonna get off here.
Yes.
Send me any messages, any questions. We're gonna start getting back on here. That's so nice. My sister's neurologist called my mom on Sunday night after my sister died. Gail, I'm so sorry for your loss. It's very hard to lose a sibling, and you will be in my thoughts and prayers. Because, yeah, it's hard. Have a good... Thank you, Bedazzled Candy. If you guys have any questions or want us to touch on any topics, I did need to touch on one topic I forgot about. One of our patients were told that she had to get all of her teeth extracted in order to get a hip surgery. She went to a dental surgeon to get dental clearance, and they said, yep, all of your teeth have to come out. She was about to have no teeth, and she was scheduled. She had messaged me. She was scheduled for Monday, and she messaged me on Saturday because she had seen the orthopedic surgeon on Friday, and he checked her mouth, and he wrote the clearance himself. He was like, it's fine. But like, this is the stuff that scares me about health insurance, is the fact this dental surgeon, who gets a shit ton of money because dental insurance doesn't cover anything,
Nor does health insurance. But
and said you need to lose every single one of your teeth. And then dental implants, Jack had them, $14,000 per tooth almost, and then they're the ones you can take out.
Dentures, yeah. So here's the dealio. When our patients are being jam-jobbed into, you need to have all your teeth removed before you can get a hip replacement, hell to the no.
Your teeth and your hip aren't even connected.
Thank God that patient had a relationship with Claudia and could text her or reach out to her and say, hey, does this make sense? No, it does not make sense. Keep your damn teeth as long as you can.
Your teeth aren't connected to your hip bone, last I heard.
Yeah, and you know what? You would have been filing for bankruptcy like the patient from Melissa Memorial. Listen, I want to
Great catch, Claudia. Thanks.
everybody for
listening
and partnering with us, and please continue to do the work you're doing. It does matter, one patient at a time.
Even if you lose one, turn around and try another, because you will get it, and if we don't, no one else will. So thanks for tuning in. We are actually live on Spotify.
I don't even know what that means, but I'm going to find out later on today.
Well, I need to show them.
Okay.
So it took me a lot of brain work, but if you look up Don't Back Down, we're on there. There's our first 3 episodes. I couldn't get that one picture of us, so it's that one.
It's all good. It's all good.
All right, guys.
All right. Have a wonderful day, people.
Bye.